Welcome to the Menopause Hour, your go-to source for answers to your burning menopause questions, the ones you won't get from your OBGYN. Brought to you by Winona, where menopause care is made easy. Download our free Winona community app where thousands of women connect and access exclusive content, expert-led courses, exciting events, and more. It's time to take the guesswork out of your hormonal journey.
Hello, everyone, and welcome to another one of our live Q&As. I'm so excited to see you all here tonight. I see we have a couple more people that are jumping in as we're getting started as well, so we'll give everyone kind of a minute to get situated and get in. But just wanted to say really welcome. We're so glad you're here. We're going to have, I think, a great discussion today. We're going to talk about all of your questions. If you've never met me before, I'm Maddie. I am the community manager here at Winona. I've probably seen your face somewhere in the app, whether you've just joined or you've been posting. I usually keep a pretty good eye on kind of the people that are around. But I'm so glad that you made it to one of our live Q&As. These are some of my favorite events that we do, and I think they're just super exciting, super insightful, fun, great to connect with other women as well. Just want to give a note as well. If you've never been to one of these before, kind of how they work is we will go through your questions. You're able to ask anything you might be wondering. And when we say anything, we really mean anything. You throw it in there, we'll get to it. There's no question that's off topic, no question that's too detailed. Throw it in there. But you're going to find a chat button at the bottom of your screen. So if you click on that, you'll find a little chat section will pop up. And I'd recommend you just go ahead and start typing your questions in there now, because it does usually start to get a little bit busy. And then we'll start to go through those. You're also welcome to send more questions throughout the time if you have one that pops up. But just wanted to point that out for you as you all are kind of thinking through. Maybe you have some questions ready. Maybe you want to think through them a little bit. But that is there for you, and we will get to your questions. But to start off, we'll kind of start off with some introductions. So obviously, I just said my name is Maddie, but we also have the wonderful Dr. Kat Brown here with us tonight. She is always quite amazing at these events, but I'll let her give a little bit of an introduction of who she is, and then we'll kind of jump into things.
Well, thank you so much, Maddie. So yes, so for those of you who haven't seen me and haven't seen my face on your Instagram feed or on your Facebook feed, because I think I'm on quite a bit of the ads right now. I'm Dr. Kat Brown. I am one of the prescribing physicians here at Winona, but I'm also the medical director as well. I do, in my job as medical director, I do a lot of outreach. I do a lot of podcast interviews, education, also curate some of our medical content for education for patients, which is available to all of you on our website. I'm a board certified OBGYN. Practiced in the Army and trained in the Army, moved around in the Army for a little bit, and then now I settled back in the Philadelphia area, which is where I'm from. And so I still practice at a hospital. I still do deliveries and practice as a laborist. And then I also do the telemedicine here at Winona to help take care of GYN patients as well. Women's health has been my passion and my love for my whole career. And as I've aged and as I've gone through my own women's health journey, my focus is kind of changing and evolving. And as we are all getting older and we're realizing that not enough focus and education was given to us, when we were younger to be prepared for this stage in life, this is kind of a passion project for me as well, to help myself, but also to help you, because I feel like, we really have been ill-equipped to really be prepared and get the answers that we need. And so that's why we do these. That's why we have these live Q&As, just to make this information available to all of you. And on a personal note, about 30 minutes ago, I was still in my garden trying to pull weeds and trying to take care of things. That's one of my favorite things to do, is to be outside when the weather's nice. I also have 3 kids and I love to travel. So I'm a real person too. So just a disclaimer, you might see a cat fly by me or a dog, or a child may try to pass me a note while we're doing these live Q&As, because I'm a real person and I'm broadcasting from home. So that's me in a nutshell.
I think it's so great just to hear a little bit who you are as well, Dr. Kat. I don't know. That's one thing I like love about these is getting to see, I don't know, like a little peek behind the curtain as well. I feel like that's always, I don't know, adds so much to kind of what life is all about, especially I think, at Winona, we believe so much in like what it looks like to be in menopause holistically or perimenopause holistically. And I think getting to see everyone's like the behind the scenes of that, of getting to meet the people that work at Winona and kind of what that looks like, I think is so special. Um, let's see, we've got a few questions to start us off tonight. Our first question is from Micah. And Micah is wondering, she says, hi, she says, I've read differing opinions regarding whether progesterone is reliably absorbed through the skin. Can you share any scientific references regarding the specific formulation used by Winona?
Well, I don't know if we're going to get in the nitty gritty of scientific formulation, but the basic thing is that when you compare our female hormones, progesterone itself is a large molecule. And so that's why there's some people that believe that it really shouldn't be absorbed through the skin. However, there's something that can be done to the progesterone, which is micronization, which is something that's done in the preparation of the progesterone to help it to be more readily absorbed. Progesterone has been used transdermally throughout, women's health as far as other functions used in IVF and, vaginal progesterone, all different sorts of things. But it's up to you. I think ultimately you have to feel comfortable with your treatment. We feel very confident that the doses of micronized progesterone that we use at Winona are safe. And we've had thousands of patients on our combination cream do very well without any bad outcomes. So I personally think that if progesterone wasn't being absorbed well, we would have seen some untoward effects by now, because we've been in practice now since 2021. And so I trust in, talking to our compounded pharmacist and how they make our cream. He's one of the smartest people I've ever talked to. And the way that they describe how they process that progesterone and how they get it in the cream, I trust it. I believe that it's a high enough dose to protect that uterine lining. And that's the main reason for taking progesterone when you're taking hormone therapy. So for those of you who still have a uterus, anytime you're going to get prescribed estrogen, which is really your heavy hitter, that's what really attacks a lot of your symptoms of perimenopause and menopause. That's something that needs to be counterbalanced by progesterone if you have a uterus, because the progesterone's main function is to help keep that uterine lining thin. Because the one bad thing that estrogen can do is it makes that uterine lining kind of fluff up and thicken. So if you don't counterbalance it with the progesterone, it can lead to abnormal cells in the uterus. So that's why we use the progesterone.
Absolutely. Thank you so much for that clarity, Dr. Kat. We have another question from Judy. Judy says, hello. She says, why are not more physicians better prepared to handle menopause? She says, my GP is learning from me, which feels very odd.
Yeah. So when you look at medical education in America, we're trying to squeeze in 4 years everything that someone needs to know about the human body, both male and female. And it's really in the residencies, which is our advanced training. So, medical school is 4 years, and that's where you get your basic core education to be a general practice doctor. But still, it's not enough. So then when you want to be a GP or a family practice physician or internal medicine physician, you have to do an additional 3 years of training to then expound upon that education. So when you're looking at the scope of what you're learning in those medical residencies, there hasn't been a focus on women's health as much in the internal medicine fields, in the general practice fields and OBGYNs as well. I think that most of the practice and most of the education is focused on fertility, contraception, management of abnormal bleeding. It's not been focused on. I'll tell you, in medical school myself, I remember getting maybe 1 or 2 hours, in 4 years of education on menopause. It was really just not enough. And this is something that we're trying to change. In fact, the Menopause Society of America just got a huge grant, actually from, I forget the name of the foundation, but Bill Gates' ex-wife, puts money and donates money. They gave millions of dollars to try to change this, to try to help expand education to more providers and more physicians. And for right now, it's unfortunate, but kudos to you for helping your GP learn, because it's really as patients when we demand better and we demand that we want help, that it's going to force our doctors to kind of get on board or not. Because if not, then we're going to keep going to someone else until we find the answers, which is why Winona exists. Really, we exist because a lot of patients out there just did not have access to get the help that they needed. And so that's how telemedicine really helps in this situation. So if you have an in-person doctor near you who can't help or doesn't have the experience, platforms like ours exist to help with that and help you through this.
Absolutely. And our next question tonight is from Jennifer. And Jennifer says, I've been using the cream for 1 week, but I haven't noticed any changes. She says, what should I be looking for or how long should it be before I notice changes? She said, I only have one ovary and no uterus.
Mm-hmm. So 1 week is just too soon. I mean, that's the bottom line. It's really early. So in the first couple weeks of starting hormone therapy, you're just trying to get your body adjusted to taking the medication and to getting the hormones to a good level in your body. So it usually will take a few weeks before you really notice some changes. Usually the early on changes that women notice are improvements in sleep, improvements in the experience of hot flashes or the frequency of their night sweats. And so those are some of the early things that we see some benefits with. And then the longer that you're on it and, we get you on a good dose, then you'll start to notice some of the other benefits, maybe some weight redistribution, your mood might improve, so many other things that could get better with taking the hormone therapy. But this is a long haul game. It's not like an instant fix where, taking it for a couple of days that you would really notice a difference, or taking it a week. You need to give it some more time for your body to get acclimated.
Absolutely. And our next question is from Katie. Or I guess it's a little bit more of a statement, but it might be helpful to expand upon, especially for those people who aren't experiencing maybe those changes right away. Katie says that she started the oral progesterone and estrogen and noticed a difference right away. Why might that be? Well, some patients, are taking so long or take a while to have those changes, and some might notice it right away.
I mean, it's unlikely that the medication is working right away, like within the first day or two. But I think that sometimes the other thing that comes into play is that most women that are seeking treatment have been waiting for so long. I mean, on average, most women go through at least 3 doctors before they find the help that they need. And so I think sometimes just getting the medication almost reduces your stress level, reduces your stress hormones. And sometimes some of those symptoms will start to get better just with the relief that that help is on the way. And so I think that could be part of it too. Or you're just really, really lucky. Bottom line.
That would be great. And it looks like our next question is from Cynthia. We got 2 thumbs up on this one, so I think this is a hot topic tonight.
Nice.
Cynthia says, hi, Dr. Kat and Maddie. She says, why or why not? And when is testosterone recommended as part of HRT? And is DHEA an alternative?
Yes. So we'll answer this question kind of backwards. So DHEA is an alternate way to help gently raise your testosterone levels. And that's what we use at Winona. The reason being is that testosterone is a key hormone in women's bodies. And I don't think a lot of women realize that. So we have our female hormones, but our body also creates and has its own testosterone as well. And the testosterone is responsible for a lot of other functions in our body other than the estrogen. But in America, testosterone is only formulated for men. It's only manufactured for men. And it's been widely abused for a long time because if men take high doses of testosterone, it's a performance enhancing drug. It makes them stronger. It makes them run faster. So athletes, soldiers, I saw it a lot in the Army when I was practicing in the Army. It can make you be a much better version of yourself as far as, when a man takes it. So as a result, it has been treated as a controlled substance, kind of like a narcotic. And so it's something that is monitored. You have to check levels pretty regularly. And we still, to this day, don't have an FDA-approved product that's specifically formulated for women when it comes to testosterone. So for any physician who's going to prescribe testosterone as part of a hormone therapy plan, we're actually going to be taking a male product and trying to extrapolate and fit that to a woman's body. So, maybe taking a tenth of the dose that a man would typically take. And so that's something that we really can't do safely through a telemedicine platform. We need a little bit more monitoring when it comes to that. So that's why we use DHEA as an alternative. So the DHEA is a precursor hormone that your body has in itself, that your body creates. But if you're not creating enough of it, it can also lead to lower testosterone levels. So when the DHEA gets processed in your body, it gets broken down into low levels of estrogen and testosterone. And so that's our way of gently raising your testosterone when you take our hormone therapy through our platform.
Absolutely. And our next question is from Susanna. And Susanna says, she says, I have been using she says on the 9th of June, so coming up next week, I will have been using the Winona pill and cream treatment for a month, but I've started to experience itching at night. She says, feeling like an allergic reaction between my legs and all my ankles. And she says, I've also developed some acne on my face that I didn't have before. Could you give me some insight on what might be happening here?
Well, the acne can be related to the DHEA supplement. So, that it is a known side effect for some women to experience acne and changes in their skin when they start the DHEA. Usually it's short-lived. Usually it's a temporary phenomenon, and usually it will get better with time. However, the allergic reaction between your legs. So I guess the question is if you're applying the cream on your legs. Most women will apply it to the forearms, on their forearm. But if you're applying it to the legs and you're noticing an allergic reaction, I would definitely reach out to your Winona doc. When you're having a response like that, that's kind of negative to a medication, you want to go right back to that prescribing physician and let them know that you're having an experience that you think might be related to the medication so they can talk to you about alternatives.
Absolutely. And our next question is from Trinity. And Trinity says, after starting the 50-50 cream and the DHEA, how long can it take to get sexual desire back?
This is a hard question because I think that, sexual desire is different for you. It's different for me. Everybody's libido is totally different. And I think that it's, related to so many different factors in our life, our relationship, our stress levels, how well we're sleeping. So many things can go into that. So it's not purely a hormonal, answer. But if your low sexual desire is related to low female hormones and low estrogen, low testosterone, then typically you'd expect that after a few weeks of the medication, you would start to notice some improvement. But every woman's on her own timeline. That's the hard part about this, is that we can't give you some hard and fast rules about, at week 3, you're going to notice this improving. And at week 4, you're going to notice this, because everybody's body is different. We're all unique. But I would hope that, within the first few weeks that you start to notice some improvement there, but it might be longer. And this is where I might go into my own diatribe about sexual desire. So for women, it's so important that everything kind of be aligned, and we have to be in the right headspace to even feel desirable, to have sexual desire, to have an interest for sex. So part of the hard part with perimenopause and menopause is that so many women make the statement that they feel like not comfortable with themselves, or they're not comfortable in their own body. There's so many different symptoms happening. So sometimes we have to get all those other symptoms improved before you start to feel back like yourself and the sexual being that you are, and notice that the desire might be coming back. And also it's important that you think about, like, the brain is actually probably our most powerful sex organ as women. So if there's other things in your relationship or in your life that could be interfering with intimacy, those might need some work too. So it's not all related to the medication.
Absolutely. And our next question is from Anju. And Andrew says, I was 10-year postmenopause and I started estrogen and progesterone simply for muscle and bone protection. She says, but since then, I've become moody and more depressed. I was never like this before. It's been a year now of me being on it. She says, I'm considering taking 6 months off and seeing if my mood gets any better. Do you have any suggestions? She says, I had no symptoms before starting.
Well, here's the hard part of this, so taking hormone therapy just for muscle and bone protection, to me, sometimes might not be worth, if you're not experiencing significant symptoms, anytime we think about a medication, you have to think about the risks and the benefits, right? So I wouldn't recommend someone go on hormone therapy solely for bone protection. If they're not experiencing hot flashes, if they're not experiencing night sweats, not dealing with any of the other symptoms that are bothersome to their day-to-day life, by taking a medication purely for its preventive benefits, you're then setting yourself up for side effects and problems. And so I think that, if I was the one taking care of you, I may have counseled you differently. But also, you could always go back to your prescribing doctor too and talk to them about what's going on. Maybe the dose isn't right for you. Normally, with women's bodies, we are most prone to mood swings when our hormones are fluctuating the most. And so depending on how what form of treatment you're taking, as far as estrogen and progesterone, sometimes it might be changing the formula. Also, 10 years after menopause, I should kind of put this in there too. That's kind of our magic window that, after the 10-year mark, it can be more dangerous to start hormone therapy if you've waited too long, because there can be a slightly increased risk if you start more than 10 years after your last period. So a lot of things to think about there, but I would go back to your prescriber and let them know how you're feeling and what's going on to see if something needs to be tweaked.
Absolutely. And our next question is from Angela. Angela says, she said, I had a hysterectomy, but I have both my ovaries, but my issue is with weight gain. She says, can I combine Winona treatment with a GLP-1?
Absolutely. And actually more and more research is coming out that, they're kind of synergistic, that hormone therapy and the GLP-1 medications actually work very well together and give patients the most benefit when it comes to weight loss. So women on a GLP-1 alone will lose a decent amount of weight, but when you combine that with hormone therapy, most women have better results when they combine the two. So in my mind, they kind of work together, and we're learning more about this. We didn't know about this when the GLP-1s first came out. But the longer that these medications are around, we're seeing more and more people doing research on it and looking at outcomes. And that's one of the benefits that we're seeing, is they can work together.
Absolutely. And our next question is from Andrea. And Andrea says, I've been on HRT for about 2 months and have noticed significant positive improvements in my symptoms and overall well-being, which is awesome, Andrea. That's great to hear. But she says, I'm wondering when I should have follow-up lab work done to check my hormone levels and determine whether any medication adjustments are needed. Is there a recommended timeline for repeat testing at this stage of treatment?
So here's where we get to go on the diatribe about testing. So actually, hormone testing isn't needed at all before starting you on hormone therapy. It's not something that's very helpful. There's no defined level at which we know that for one woman compared to another, that they're going to experience improvement in their symptoms. So it's really not useful information. So it's actually more beneficial for us, and for me specifically, to look at your symptom diary, to look and see how you're feeling. So quantitatively, objectively, if you're feeling better, you're sleeping better, your hot flashes are reduced, your other symptoms that were bothering you are getting better, then that's enough. You don't need to get a hormone level checked to determine if you need to change your dose. It's really not helpful to do that. In fact, providers that do that and check levels and try to tweak medications, it's kind of like chasing your tail. You're not getting any valuable information, and it's really not helpful to get the level to then adjust medication. And it's not just my opinion. It's not just Winona's opinion. This is something that's endorsed by the American College of OBGYN and the Menopause Society. They all recommend against routine hormone testing. The problem is hormone testing is a big business, and a lot of places will want to do hormone tests for you maybe several times, and then they'll charge you several $100s each time. It's just not useful information, and the experts don't recommend it.
Absolutely. And I know that's a question that we tend to get a lot on these calls too, Dr. Kat. So I think it's always obviously a very prevalent question that's happening. I think, especially to your point about it being a
And
big
it's
business.
confusing because I think in every other arena in medicine, like if you're feeling weak and tired and you get your blood drawn and it shows you're anemic, You can look at an anemia level and know that you need to take iron, right? Thyroid hormones, you can have an underactive thyroid and they check the levels and then they tweak your medication based on that. The problem is female hormones are released in such an erratic fashion that they don't behave like anything else in our body. And so that's why the labs are just not as useful. The levels can vary from day to day, from the time of day. Like if you were to get your blood drawn in the morning and then drawn again in the evening, the levels might be totally different. And so it's really just not helpful information for us.
Absolutely. And I see that there's a few people typing, so I'm going to give them a second to see if there's any more questions for them to throw in the chat. But Dr. Kat, I would love to know from you as well, with someone who's maybe kind of just getting started on either with Winona or on HRT or kind of on that journey, what do you think is the most important thing for someone to kind of know about getting into HRT and
Mhm.
beginning that whole process?
Yeah. I mean, I think the big thing first is to choose a treatment form that is going to fit into your lifestyle the best, right? So there might be experts on the internet. You might see women talking about that this is the latest and greatest and they love this, but you have to think about what works for you. Like, so, a patch might work for one patient, a cream might work for another, but maybe you're somebody who already takes pills and it's just easier to just add another pill to your day-to-day regimen. And so that's the first thing, fitting it into your routine. And then the second thing is starting to make it a habit and taking the medication regularly once you receive it. That's one of the hardest things to do, is to get used to taking the medication regularly, because if you're not able to do that, it's going to take your body longer to get adjusted. And that's one of the hardest hurdles for a lot of women to get over. And then also knowing that the medication alone and hormone therapy alone is not the only answer. It works in conjunction with other things like lifestyle modifications, behavioral changes. So it's not like a magic pill that's going to be a cure-all, right? You still have to take care of yourself. You still have to try to optimize your sleep. You still have to try to stay hydrated. Focus on your nutrition, making sure you're getting enough protein, enough fiber, getting all the nutrients that your body needs to stay healthy and strong. And so I think that, you have to do all those things. You kind of have to hit it from all angles. This really isn't like a bad time in life that all of a sudden you're attacked and you have to get these medications on board. I kind of see it as like a call to action. Like, now, like, okay, ladies, we need to wake up and we need to start taking care of ourselves as we're aging so that we can live our best life, right? It's about refocusing our energy from outward on everything else we're doing back into ourselves and focusing on ourselves to get ourselves feeling better.
Absolutely.
Yeah.
Yeah, no, I think that's so important to remember. I love that did you call it a wake-up call? Is that right?
Yeah.
I like that. That's a good way to put
Like
it.
a call
Yeah,
to action,
absolutely.
it's like
Call to action, yeah.
it's like these little symptoms that start creeping in and start to bother us so much. It's like our body like asking for help, right? It's kind of like a wake-up call.
Absolutely.
Yeah.
Absolutely. Well, I think that looks like that might be all the questions that we have for tonight. But I just want to say thank you everyone for coming. If anyone does have any last minute questions, feel free to throw them in the chat and
Oh,
never mind, we do have one more. It was like perfect timing. All right. Well, we have a question from Whitney. And if anyone does have any more questions while we're answering this one, feel free to throw those in there as well. We'll get to them. We've still got some time left, so we'd love to answer any of the questions you've got.
mhm.
But Whitney says, I'm exhausted all the time. Like I can barely stay awake during the day. She says, I did pellets with estrogen and testosterone, but I didn't like the roller coaster feeling I got with my hormones. Will DHEA work as well as testosterone injections? She says, I have done pellets for 4 years since I was 35, as well as sublingual progesterone. She says the PO form, the PO form, is that correct?
Yeah, that means by mouth in the medical world.
Perfect. Awesome. Whitney, you know your lingo. I love that. She says, as well as the PO form, made me really nauseous. She says, I just want something that will give me more energy during the day, help me sleep at night, and give me the drive to want to do things that I used to enjoy doing.
Yeah, so I think the hard part is, I think we should start off talking about pellets in general and the difference
Yeah.
in pellets compared to traditional hormone therapy. Um, you know, I'm not a big fan of pellets, mainly because it's an invasive procedure. And the doctors that are doing pellets, some of them do them very well. And I know patients, and I have had friends that have used them and done very well. But for the most part, my general consensus and most of the patients I've talked to that have had a pellet experience describe what you're describing, this roller coaster, right? So they're taking their best guess of what to give you, and they're giving you 3 months of medication in a reservoir, like a pellet. Think about, when we do like identification and we do the scanning, we insert that thing for our dogs so that we can track them if they get lost. Think about that as kind of like a pellet. So it's a big, large bore needle that holds this reservoir of medication, and they're injecting it into your body, and then you're stuck with it, right? So you're going to experience the medication. You're going to get the medication as it's slowly released over time. But depending on where it's injected and where the pellet's put in your body, you might metabolize it differently. You might have days where, you might be more active. You might get more medication out of the pellet, and it might be up and down. But the really downside is that when you're the patient who gets a pellet and then is having horrible side effects, you're stuck with them until that pellet completely dissolves, right? I don't like that. I don't like not having control to be able to change things, do things differently. So that's why I'm not a huge fan of the pellets. And also, for most doctors doing pellets, their thought is to give you very high doses of testosterone, because our body will convert some of the testosterone into estrogen as well. And so sometimes they'll go really high on the testosterone, which helps your energy, helps all these things. But you can also have the risk of having masculinizing side effects from the testosterone if your body doesn't convert it, meaning that you could get male pattern hair growth, get a mustache, get a beard. You could start notice male pattern balding. You could start having changes in your voice. And if you're exposed to too high levels of testosterone for too long, your clitoris can actually get enlarged, like almost like it's trying to grow into a larger penis. So yeah, some bad things can happen to patients when they get too much testosterone. So, I think that it's going to be interesting for you to change to different form of medication if you've been on that, for 4 years. But I think it's worth trying something different to see how your body responds. And I think that going on a good dose of estrogen would significantly help with your symptoms. But you might notice a change going from those high doses of testosterone down to the low levels of the DHEA that we use, which are much lower doses. Because they're safer to be used in conjunction with the other parts of the hormone therapy. But I think it's worth a try. You never know how your body's going to respond until you try it. And medications, a lot of the times, are not guarantees, right? So it's very much trial and error, and it's kind of like trying on clothes. You can't like look at an outfit in a store and say, I want that in this size, and just go home with it. Who does that, right? Maybe you go home with it, try it on, and then take it back. But most of us have to try it on. Same thing with medication. You have to try things on and see how your body responds. And that goes for any medication, not just hormone therapy. If you're getting headaches and someone gives you medication for headaches, you try it for a little while. Doesn't work, you go to plan B, you go to the next medication. So same thing. We sometimes have to tweak things until we get it right, until we try to find the right formula for you. And that's why your treatment should be individualized. And you should work with a doc directly to kind of go back and forth to find what works best for you. And we'd be happy to do that for you if you're willing to give it a try.
Absolutely. Yeah, I think maybe we talked about this some other time, Dr. Kat, but I love how you said like it is, everything is best a lot of time when it is individualized on that end. Because I do think, perimenopause and menopause, it's such an interesting conversation because every woman will go through menopause. We will all have that same experience, but everyone's journey is going to be different. So I think you're complete. I mean, I think that's like great to hear like the medical side of that as well. Or, there's like that emotional side, but there's also like the medical side of what the journey of menopause looks like that way. Absolutely.
Yeah, for sure.
Well, I think that is all the questions we have tonight, but thank you so much, everyone, for coming out and just making a little bit of time out of your evening to be here, to ask your questions, to listen, just to really think about the journey that you're in right now. I think that says a lot about what you're doing to kind of take control and take the reins of your medical journey. I think that is a huge thing. I do just want to point out as well, if you're interested in some more resources like this, or you want to listen listen to some more conversations, hear questions from other women. We do have lots of episodes like this. Well, we do these events. We have live Q&As every month. We also have Doctor Dialogues where we have an expert guest come. So we'd love to see you at those. We also have the Menopause Hour on Spotify. It is our Winona podcast. We have a lot of these episodes on there, so you can listen to them at the gym. You can listen to them in the car while you're making dinner. We do also have some other episodes as well where we do interviews with some of our ambassadors or real patients. So I always think those are really interesting just to kind of get some deeper insights to dive into conversations. So would definitely recommend checking out those. And then also just a reminder that if you are a Winona patient or if you become a Winona patient, your Winona doctor is always available 24/7 for you in your patient portal. So it's essentially a lot like this where you can send them a message, put all your information in it. I know sometimes, especially when I would go to the doctor, I would have to like write down to remember everything and then I would still forget, to like say something. It's kind of nice this way because you can like make sure that you have all the information and then add other things in later if you want. So just a reminder that that is always available. Your doctor wants to help you. They want to hear what you're going through and they'll really help you find a great path forward. So those are just a couple resources that are available. There's also lots of resources in the Winona app that I recommend checking out. As well as so many other things, including we have workouts, we have our Winona 101, lots of different events and resources, whether that's journals or symptom trackers that you can check out as well. So definitely recommend checking those out. But thank you so much, everyone, for coming tonight, for making the time. So great to see you all. And thank you, Dr. Kat, for giving your time tonight as well.
Yeah, no, thank you so much for coming out. These are always good conversations and there's always good questions. So yeah. And don't forget to, follow us on social media if you're into that. On Instagram, you can find me at Dr. Kat, OBGYN. And dive into the Winona website too. So there's so much good information. Like if you just want to like look up symptoms, it's much better to go to bywinona.com and search for your symptom and read a curated medical article that's been validated and has good medical information rather than just Googling too. So
absolutely. Well, I was going to say, Dr. Kat, I love your account. So would definitely recommend following Dr. Kat. She has some great information on there. So always fun. And I love to like get to see like little bits of your life and kind of what that looks like too. So I think it's a great thing to check out for sure. Well, I hope everyone has a great rest of your night and hopefully we will see you at the next one of these. And just as a note too, I think like Dr. Kat was saying, everyone always has such great questions and there's always so many new questions that I love, so many wide varieties. So that is also the cool thing about these is they'll never be the same event. So you can come, you'll always learn something new information. You don't just have to come to one, you can come to as many as you want and it will be like a new experience. So hopefully we'll see some of you all at the next one. But I hope everyone has a great rest of your night and we'll catch you next time.
Yeah, sounds good. Good night, everyone.
All right. Good night, all.
Thanks for spending time with us. We hope today's conversation helped you feel more informed, more supported, and a lot less alone. If you're ready to go deeper, download the Winona app. It's free, it's for you, and it's filled with resources, real stories, expert insights, and a vibrant space to connect with women navigating the same season. Have questions? Join our next live Q&A. Until next time, take care of yourself. We'll be here when you're ready for more.